Mr. Secretary, it is so good to see you. Like other colleagues, I've had the privilege of serving with you, not only in the House, but also in the California State Legislature. And I want to join with comments made by others that we could not be better served than to have you as our Secretary of HHS. I'd like to begin by thanking you and President Biden for including a request for $200 million to fund a maternal mortality initiative, because so much more needs to be done to address the maternal mortality crises in this country, in which the hardest group of folks are Black, Latino, American Indian, and Alaskan Native communities. It also includes, as you know, mothers and babies also experience different outcomes based on where they live. There was a plan put together in recognition of the disparities in maternal health last December by the Surgeon General, and he issued a call to action to improve maternal health, and the Department of HHS rolled out the Healthy Women, Healthy Pregnancies, and Healthy Futures Action Plan. And the plan outlines 3 specific targets to improve the nation's maternal health outcomes by 2025. And they are to reduce the maternal mortality rate by 50%, reduce low-risk cesarean deliveries by 25%, and to achieve blood pressure control in 80% of women of reproductive age with hypertension. Is it your intention as Secretary of HHS to continue this work that was underway in the past administration?
Congresswoman Roybal-Allard, thank you for the question. That's an easy one, of course, and you know so very well from knowing me for so many years that if we think it's a priority, I know you think it's a priority, but my wife, if I were to go home, who is a maternal fetal medicine specialist, would not let me in the house if I didn't consider these priorities. So we are going to work these hard because it is important that not only are women allowed to live a healthy life after they've given birth, but that their children are allowed to grow up and be healthy as well.
Okay. I have another hopefully easy question here, Mr. Secretary. Since the initial passage in 2008 of My Newborn Screening Saves Lives Act, it has helped ensure high quality diagnosis and life-saving follow-up interventions for over 12,000 newborns diagnosed each year with genetic endocrine conditions. And as you know, the Newborn Screening Act codified the Advisory Committee on Hereditary Disorders in Newborns and Children to help address the vast discrepancies between the number and quality of state screening tests. Because of this committee's work, today 49 states and the District of Columbia screen for at least 31 of the 35 currently recommended core conditions. In September 2019, the reauthorization of the newborn screening law expired, and it is my hope that it will be reauthorized this Congress. Unfortunately, the previous administration suspended the activities of the advisory committee, which is preventing it from completing its work. As Secretary, you have the authority, which is reinforced in the 2014 newborn screening reauthorization, to deem the advisory committee a secretarial advisory committee and to continue its charter. Given the essential role the advisory committee plays in our nation's newborn screening system, will you use this authority, and when will you extend the term of the committee until reauthorization occurs?
Congresswoman, I fully understand the value of that type of work that has to be done. And what I can tell you is that while a decision hasn't been made, I can get back to you as quickly as possible on the course of action that we will take administratively. But without a doubt, I think what we want to do is move forward, not step backwards.
Okay, and I look forward to working with you on this, because this committee, advisory committee, is absolutely essential in doing the work of protecting newborn babies.
I appreciate and agree.
Congressman